The earlier you have treatment, it's probably the better. Sometimes people aren't able to have treatment, and that's okay too, provided people can live an healthy lifestyle, and say cut out fatty foods and cigarettes and grog and all that kind of stuff.
The treatment means taking a tablet every day called ribavirin and having a weekly needle called pegylated interferon.
Here we've got the injection, which is pegylated interferon, and you'll have that injection once a week for the next 6 months. Because you've got genotype 3, that's how we know you'll need to take it for 6 months. But other genotypes, they might need to take it for 12 months, but it's always a weekly injection. And you need to have this on the same day each week. All right? It can have some side effects from it. Often, the most common one is a flu-like symptoms, and it can happen quite quickly after the injection. And if you do have any of those kind of symptoms, feeling hot and flushed and tired, we'll just get you to take some Panadol and treat it like a flu for the next day or two, but it should gradually get better during the week. Right?
Treatment can be pretty rough, so it's good to think about what time is best for you. Your doctor at the local health service can help you figure that out and give you some more information. And you can always call the Hep C info line and talk it through with your family. For some people on treatment, you can feel tired, have chills and fevers, sore muscles, headaches. Sometimes our mob can go on treatment and feel depressed and sad too. There are other symptoms you can feel on treatment, so ask lots of questions and your doc or liver clinic will tell you all the possible side effects.
There's a 50 to 80% chance of cure from the treatment, and so the odds are in your favour.
We know that over 90% of new cases of Hep C are actually a result of sharing drug injecting equipment.
If you're injecting drugs and not using clean equipment, the chances of you getting Hep C are very high, and you can even pass it on to your mates. So get your own sterile injecting equipment.
Hey Peter.
How you going?
Good. That's good. So what do some of these things include?
Some of these things, most people just think of first as syringes, but you should also think about cotton wool that goes to filter things, swabs that you use to sterilise the injection site and the equipment, and especially tourniquets if people are sharing them. Also spoons and the mix going in there. You got to think about where blood might be able to transfer from one person to another. So, and if you're using this equipment, you can get it from needle and syringe programs for free, and usually pay a small amount for it at the chemist.
If you are injecting drugs, it's really important to wash your hands, because we know that small bits of blood can be present and the virus can actually be passed on that way. Sometimes there can be blood present when you're snorting drugs. So we just suggest that if you can, to avoid sharing the straw when you're snorting drugs. And also if you're considering getting a tattoo or a piercing, to go and see a licensed professional, and just while you're getting the piercing or the tattoo, to just make sure that they're using all sterile equipment, that they're opening it all in front of you. It's very unusual for Hep C to be passed on through sex, because we know that Hep C is actually a blood-borne virus. So in order for it to be passed on, there has to be blood present. So times when blood can be present is during anal sex, or if somebody has a sexually transmitted infection, or during women's monthly business. So we just encourage you to be blood aware. We provide information and education, and we also have lots of information here that we're happy to send out, lots of brochures. We have an info line that you can call if you need support or referral.